everybody. This is Megan Antonelli, CEO of Health Impact Live, and I'm excited to be here today for our April edition of 5 Good Things on Digital Health Talks with my friend Janae Sharp. Hi, Janae. How are you?
I'm great. I'm thrilled to talk to you today about 5 good things.
It has been quite a month, quite a quarter. I think with HIMSS and Vive, and we've talked a lot about, kind of the national traveling that we've all done. You just got back from a regional event right there in your backyard in Charlotte, the Health Innovation Day. We were excited to be partners there. So it's exciting to see what's going on across the nation as far as healthcare goes. We had quite a time at at Vive and HIMSS. And I think one of the things that, I thought about a lot while I was there is, these national stages are important and it's great. And we love hearing from everybody there, but hearing what people have to say, in smaller rooms, kind of off the stages in these, regional meetings is so different. And it really is obviously what Health Impact is all about. But, one of the things that we're most excited about, kind of coming out of there is starting and launching these operators dinners, our operators table dinners for folks that we've already sold out in Boston. We're doing one we'll be doing another one in Orlando around the American Telemedicine Association Nexus meeting, May 12th. And then, of course, back in New York, June 4th. And we have solidified and finalized our dates for New York on October 6th and 7th for our Health Impact Forum. So excited to kind of see that. And I think seeing the group that you had there at Charlotte, kind of just reinforces that. Tell us a little bit about how it went.
I really liked being part of it. Just that the Charlotte community comes together and people from multiple health systems were there. They were talking about how their startup experiences went. They had physicians, they had patients, just sharing what people are wanting right now. And some of that was about technology. Some of it was about burnout. And a lot of it was about what we want for the future of care. And I think that's top of mind for a lot of people, what they want, like how we could improve things.
Mm-hmm.
Yeah. And I know.
Yeah. And tell us a little bit about the Pearl. I haven't been there yet. I've heard Rasu talk about it quite a bit. I've seen his presentation, but what?
Yeah, he likes it. He has to, it's his job to like it, right? I really like the space. I think they also designed it with use in mind. Like when we were all there speaking, it was a big enough room for, we had 200 people who went to it. And also everybody could speak. They have those little United Nations microphones, so that
do I get to control those though, or can people just talk whenever they want? Because I'm not into that.
I'm not sure. Like, honestly, I don't have a lot of audio visual experience with that space, but it was great. And the lighting is nice. There's parking at the place. So that's important.
What's there now? Or is there medical facilities and academic facilities? What's really, kind of anchoring the real estate project?
I think there is a medical device company that has a presence there. Siemens didn't have a North American footprint, like a flagship location. So they have their flagship location in Charlotte now.
Oh, wow.
And actually the guy from there saw me outside looking around and helped me find my way inside. So good. Yeah. And there are a lot of education spaces and meeting spaces.
Did he get you a cup of coffee though?
No.
Batteries?
No. Maybe. So Siemens Healthineers people, when you listen to this, your team's fantastic. Your team's fantastic, but we want some merch. That'd be great. No. And it was nice. They have security there too. They have this kind of open space too, where you can sit, like, how they have like those seating stairs and like a lighted area. So that was kind of nice when people were pitching to see there. So, and we got to be part of the classroom and part of the, like a bigger space where you could eat. And then also that kind of open, I don't know what it's called.
Nice. Atrium.
Yeah. An atrium, if you will.
If you will, no pun intended.
No pun intended.
In terms of, and there was a pitch competition.
Yes.
Who were the winners?
The winners were Foresight Cares, which was a Charlotte-based company that talks about mobility and aging.
Mm-hmm.
So you could get real-time feedback on how your mobility works and in a professional care setting. And I think that was a virtual care model for physical therapy. Kind of cool. You know,
Yeah.
They can tell you, they can videotape you and see if you can touch your toes.
Yeah, don't do that.
It's probably for aging in place, yeah. But also there was an Audience Choice Award winner. I really like it when they have Audience Choice Award winners. And that was Tesefi Medical Solutions, which is a urinary monitoring system, like a better system of catheterization.
Got it.
And that's kind of nice. Like, it was good to see like the medical device and technology ecosystem in place, because I think a lot of times when we talk about it, you know, the bio life sciences, you don't always have as many devices at those events. And it was nice for me to see.
Yeah, it is. It's interesting, and it's such a large market in terms of the devices. And Olga Mueller of Kepler, the Kepler team, she was sort of behind that. And I think the CEOs on both of those companies are women. So that's exciting. Always nice to see that the female founders winning. So we'll have them on the show in the coming weeks too, and we can all learn more about it. So definitely a good thing. Good things coming out of Charlotte, which is exciting to see. And we are, kind of excited to maybe, get back down there ourselves and see what it's all about. But I'm so glad you got to go to that.
I hope everyone from Charlotte shares with us their good things.
Yeah.
So that we can amplify that, tag us on social media, make sure to email us, tag us, follow us everywhere.
Social media. Did you see our friend Carol Flagg's social media post this week? That also came out of HIMSS, where she did the "What Can AI Do for You" video, which was a take on the old UPS one. Oh, it's so good. You got to check it out.
Oh, you have to tell me what did she do? What can it do for me?
She asked like everyone she talked to at HIMSS, what can AI do for you? And people gave her answers, and she put it all on a video, and it's awesome. You got to check it out. I'll send you the link. We'll put it on ours. But speaking of social media, we have to have a musical segue.
What is it?
So the 90s are all the rage. We're watching Love Story. We're doing all the things. For those of us,
I haven't watched yet. I'm going to have to watch this, but I do have the teal eyeliner on right now.
You have to watch it.
For those of you who are joining us via radio, you don't know this, but I have light lipstick on and teal eyeshadow.
And we are down with OPP because that was Stefan Konya's post about the return of ONC. No more ASTP, ASTP, what is it?
ASTP, I believe.
So that was exciting to see. And I think, I don't know what it means necessarily. Does it have a significance other than some shifting of those responsibilities and that no one really got behind calling it ASTP?
I think it's also just kind of moving where the responsibility lies. And that office, ASTP, I believe, was established in 2004 under the Bush administration, but it really, some of the priorities shifted under Biden in 2024, focusing on that policy, but there wasn't necessarily a clear direction and clear way that all those offices work together. And they announced that at the same time when they were getting comments on RFIs. So it was interesting.
Yeah. Well, I'm just glad that we're back to ONC. I am.
We love ONC. We always have.
I'm going to give us another little shot.
Yeah.
Sorry. I liked his post. I thought it was cute. And I like that we're back at ONC. So it is a good thing in my book, as is the 90s and hip hop.
Yes.
For sure.
Yeah. So ASTP is supposed to move under technology. ONC is great. It's going to be fun.
It will. We can go talk more about Love Story, or we can talk about other important things in health IT, like Tom Brady.
Yes.
How was that for a segue?
I thought that was good. Massachusetts,
So,
speaking of Massachusetts.
Yeah. So there you go. But this week, we heard that when Tom Brady was announced as their backer, and I think he's got some level of a title at eMed, which is a telehealth company that's focused on GLP-1s. But they hit a $2 billion valuation this week, which I think is a pretty big amount. And we're hearing a lot around investments in that space. I think Whoop got some more investments, and there was just a lot of discussion of that. I think what occurs to me and what I find most interesting is the association of Tom Brady and kind of some of these, the athlete. We've got Serena Williams repping Mounjaro and Zepbound and all of that. And I think there's an interesting dynamic that I've been noticing. So, we talked a few months with Joanna Strober of MIDI Health about that rebranding of sort of prevention to longevity, right? And as I was talking to her and kind of thinking about this and thinking, well, finally, and I've talked to a bunch of people. I've also mentioned it on the show, even Eric Topol's book around aging. I picked that up thinking, okay, finally, we've got a cardiologist, a scientist. He's going to talk about aging. This is going to be it. This is going to be my answer. And it was like, eat well and exercise. Oh, well, that's just prevention.
Really seems like something they keep pushing home, But turns out if you have a healthier, better lifestyle, you are healthier and better.
Isn't that
breaking
crazy?
News? I'm ready for my million. Yeah.
So, but then right around that time, I had an opportunity to tour the Chargers, the team here. I know you're not into football. The Chargers football.
Don't say that on camera.
Practice.
I love football. I'm happy to go watch a game. It'll be like bringing someone for whom it is new and exciting every time.
Well, they have to practice, and they have a practice facility. And going through that, but first you go through the offices, and it's an office building. But what you realize as you go through their cafeteria, and they tell you how everything they eat is tracked on their phone immediately from when they order it to they don't even have to take pictures. It's just automatic. And of course they go to the gym, and every machine is connected, and every machine is tracked, and everything goes up on the screen. So they're all looking at it and seeing and gamifying it, because of course it's a $1 million facility devoted to keeping 60 men healthy. And there's no limit to the money that they can spend, attached to 3 football fields plus a rehab facility, right? Where they've got the state of the art equipment. They've all, 10 infinity pools and gravityless treadmills and just this unbelievable thing. And they're, on top of it, it's a UCLA Health branded facility. And so it occurred to me that we have this incredible performance medicine space and world. And then here we have sort of this longevity and prevention all coming together. And I think, as we see the wellness devices and wearables kind of taking shape and becoming more mainstream, and maybe just, becoming part of the healthcare ecosystem, not just the worried well or the hyperneurotic or even the actual athletes who are super fit. There's so much to be learned from both sides, and you've got even folks like Gautam Gulati, who's got a company called The Well Home, about home and what's going on there. And I think there's just, as health systems reposition themselves for healthcare everywhere, there's a lot to be said for this sort of convergence of performance medicine and what healthcare everywhere really means, and how it could mean that, we aren't a sick care system anymore, but we become a true preventative medicine.
Yes. I think that's so true. Like, healthcare can learn so much from performance medicine. I remember Billy DeMong spoke at an event I was at, and he was talking about how much they measured everything about their performance and angles for, I believe he's a Nordic combined skier. So an Olympic gold medalist. And just that level of precision, using that level of precision, measurement, and science to reach your goals is something that not everyone does. It's just not only do you not have the time, you might not have the budget. So if we can take those learnings from professional sports and from professionals who are really, their whole job is to maximize their performance. If we can take that and have that same system on a smaller scale work for other people, our overall health would be way better.
Right.
I will say I'm somewhat skeptical of celebrity influencers. 100%.
And I think that there's a fine line between all of it. And to some degree, there's, and that distinction between, sort of the wellness movement and, certainly as we get into, less tested, less evidence-based practices of what's real and what does make sense for healthcare systems and organizations to adopt, right? I mean, you've got tons of, the Pronovos and the Ezras in terms of the scans and whether or not that provides value. Well, it must provide value to someone because people are paying for it. And if they pay out of their pocket, it is providing value to them. Just because it doesn't provide value to, maybe the general healthcare system, or they can't monetize it in the way that they want to, and they fear it will cost them more if they pay for it, you get into this whole what we do for the system versus what we do for the individual, right? Which, kind of brings us back to sort of that human-centered care. But I am for sure, you take all of it with a certain...
Yeah, I mean, I think sometimes it's like you raised a bunch of money. Now you have a giant budget, and someone who used to be one of the top 50 highest paid athletes is now getting paid even more to tell you what to do. And the secret is, guess what? If you got paid that much, I bet you would be just as healthy,
Right.
To me, that's not groundbreaking. And then I think about some of the scandals, like they were involved in the FTX scandal, in a different scandal, in Mississippi, they had a Medicaid scandal where Brett Favre, I think, didn't know this, but got money from Medicaid. And so I have a little bit of like a mixed feeling about that,
And to clarify, I mean, this is Tom Brady you're talking about, and he is their chief wellness officer for whatever that means.
Yeah, what does that mean? Does that just mean you're a paid influencer? Maybe.
Right.
And also, I don't always want to hear advice from someone who's like, this is my smoothie today. Like, I want to hear advice from someone who's like, seems a little bit more like a real person.
Right.
Not that he's not real. He's real. Maybe that's our good thing. Tom Brady's real. But, that's just me.
Yeah. Yeah. No, I think, I guess the good that I'm distilling from it is, attention being put towards kind of general health on a very high, at a very high level. There's pinnacle of both performance medicine and sports. I think, I saw also, I think it was our friend Michael Millinson talking about, what the investor lineup looked like. I think this one was about. So his quote, I'm all about social media this episode.
Hey, good things, social media. Go.
If ESPN married the Wall Street Journal, the guest list might read like the list of investors who just gave Whoop $575 million. So then he goes on to talk about it. And I guess LeBron James and a bunch of celebrities are in that list, I love that. And so celebrity athletes. So it's just,
I love that. Speaking of that, at the innovation event, someone was like, I worked out today without my Whoop, without my watch. And I was like, this is relatable.
Right. Does that mean it even,
just imagine going outside and taking a walk without your step counter.
Mm-hmm.
Couldn't be me.
Right. Yeah, no. So it's, it comes down to, I like attention for healthcare, whether it's, and I think the goal being that attention then brings to light what we can do and how we can improve to give people the value where they do want it. Right.
Yes.
But speaking of being maybe a little bit skeptical and being a pessimist, have you seen the new documentary, the AI doc, How I Became an Apocalyptimist.
No, I only heard about that today from you. So I need to know more about this. Why do we need to watch it? And am I going to like it?
Yeah. So I haven't seen it yet because it's in theaters, but it's only in theaters at like 4 p.m. and 9 p.m. So I am planning to go see it this weekend, but I did sit in on a call about it with Tristan Harris. So Tristan Harris is the founder of the Center for Humane Technology, and he's that was the organization behind The Social Dilemma, which came out in 2020. And so this movie, he's affiliated with it in some way. I think maybe he's interviewed in it, but Sam Altman is interviewed in it. The CEO of Anthropic is interviewed. And I think that they're trying, at least what I've distilled from that video, from the Zoom call, is that it really is about kind of the positives and the negatives and how you embrace the promise while you try to sidestep the perils, right. which really struck home for me, because I feel like that's everything that we talk about in technology, in healthcare forever. Forget AI. It's always been, there is always a sort of downside or a potential risk that we expose ourselves to when we implement technology in healthcare. And we are always chasing the promise and often sometimes miss the promise, but are going for that. And I think with AI, it is only so much more amplified. And that's what the AI doc is about. But mostly, I think the good thing is the word apocalyptimist, because I think that really describes both of us very well.
Yeah, I think that also describes a lot of people in America right now. Like in the news, like, oh, everything's, war, that's a lot. And I think earlier in the week, you talked to me a little bit about being overwhelmed, but still like moving forward positively. And I really liked that idea that you can acknowledge that things are tough right now for a lot of people. 2/3 of Americans are delaying care. 80% are really concerned about healthcare costs. 1 in 5 aren't filling their prescriptions. We look at the news. These are not happy things. People are fighting online. People are fighting in real life, but we can still move forward positively. I don't remember what you said, but it was really good. So I think everybody should hear it.
I think that we were talking a little bit about sort of the sentiment of coming out of HIMSS. You come out of these events where there is this optimism, there's an energy, there's big stages, there's big lights, you're in Vegas. But we know that so much of what we talk about and the realities that people have to go back to are tough resources within their health systems, situations with patients and care getting harder and harder, not easier. Healthcare, right. No matter how much technology we throw at it, healthcare is never going to be easy. And in a world where mental health crisis and everything gets more and more complicated, it just doesn't get easier. So it is, how you can affect the small places of change. And I think even those who are working in the government right now, to go back to ONC and OPP, they are ensuring that they remain positive and impacting and affecting what it is that they know they can and where they can make a real difference, regardless of maybe some other areas where we feel less confident in the future and stability of
right. And I think that's really, it's related to even some of these events that we were talking about, like going from this large scale where it might not look bright, like we can have these smaller focuses, things we can control that become more positive. And just like we're going to have smaller localized things with people who care about the community and know the community. Being able to have that smaller focus can help people be positive. So I love that.
Yeah. And I do think it comes back to that, big stages are amazing and you can get powerful messages to the masses. But there are very few people who can talk about everything. And there's a lot of things that you can't say on a big stage that have a lot to do with how things can and cannot be implemented and how things can't change. Right. When you're on a big stage like that, you do have to worry a little bit about who you might offend. And not everybody does. And some people just offend people.
Some people just say it.
And we do try to recruit them for sure.
I got to speak about appointment scheduling. I was like, if you can just let me schedule with a provider in my network that my insurance covers and it's not an absolute nightmare, I will feel like AI has arrived. And literally people were clapping.
Right. Which is also a sad state of affairs, because that shouldn't be offensive. It should just be an easy ask.
It shouldn't be. That being said, this shouldn't be groundbreaking, but it is.
Right.
Yeah.
Right. Well, and then, we talked a little bit about mental health. As one other thing that we had on our list was Universal Health Systems is going to be acquiring Talkspace, which I think is a really interesting move as we think about where healthcare is going and how they do survive in a resource-strained environment. We talked a little bit earlier today about what is innovation. Innovation isn't always a new startup down the street, or it's not even necessarily an acquisition. It's fixing problems. But One thing that Talkspace, I think, does is address the access issue for mental health, across the country. And for UHS, which is the health system, to make that purchase is a really interesting one. And I think I'm excited to see kind of what that change signals, because I think it's a major shift in kind of, sort of care delivery models and where they see their role in delivering care.
Yeah, especially if they feel like that's a valuable investment, because they'll see it's a valuable investment that when they're responsible for the whole person. Mm-hmm. That's when mental health matters.
Right. Yeah, no. And it is, I think it's interesting from both the scale to which Talkspace already kind of sort of sees patients or has patients on a national level, and also kind of just integrating those care delivery models, which I think we're seeing signaling towards that. And then what happens as a result, to impact reimbursement and even the credentialing required for telehealth providers and things like that, So
yes,
we can't turn off the show and say goodbye without plugging our friends at Sway Health, speaking of Tom Brady, I can't believe we didn't make that segue, but they are going to be in Foxborough,
Massachusetts once again.
we will be with them in Foxborough, April 30th to May 1st. And, I went last year in San Diego, and it was just such a great time with other health IT marketing execs and hospital marketing people, and I think that intersection of kind of messaging and communications in healthcare, plus the marketing of how these, IT companies tell their stories and create value for hospitals. It was such a great to be a part of it. So we're excited to go there this year and come to our website and subscribe to our newsletter. And you can get a chance to win a free ticket as well as a discount, $300 on the registration.
So we hope you will join us there. I love that community. It's so supportive. And I hope you subscribe, share, tell us your good thing, and subscribe to our podcast on whichever platform you prefer.
Yes. Excited. Thanks so much for being here. Thanks, Janae. Have a great rest of your spring break and weekend. And to everybody else, subscribe, and stay tuned for what's next with Health Impact.